Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram. Welcome to our Corporate Health series, where we aim to bring you awareness on all aspects of your health and well-being so that you can enjoy a productive and successful journey ahead. We must remember that good health means that all the various organ systems in our body need to work without disease and in optimal condition. Today, we are going to talk about an organ that pretty much defines who we are. It is often described as the most complicated organ that nature has ever created, an organ with capabilities that no supercomputer can match till this day. Seat of intelligence, interpreter of the senses, initiator of body movement, and controller of behavior. Source of all the qualities that define our humanity, the crown jewel of the human body. This 3-pound organ that lies in its bony shell and is washed by protective fluid is the human brain. Today, we are going to talk about this amazing organ, which needs to be protected and maintained just as every other part of our body. Your brain ages just like the rest of your body. It shrinks in size, slows down in speed, becomes less adaptable to change. But there are steps that you can take to make sure that your brain is healthy and active for your entire lifespan. So today we are talking about brain health essentials. And to discuss this very important topic, I am delighted to welcome none other than Dr. Alok Ranjan. Dr. Alok Ranjan is a distinguished neurosurgeon specializing in minimally invasive and complex spinal surgeries. He's been at Apollo Hospitals, Hyderabad since 1999 and has performed over 9,000 major neurosurgical operations. Dr. Ranjan's medical journey began with MBBS from the Christian Medical College, Vellore in 1986, followed by an MCH in neurosurgery in 1992. His career includes roles as a faculty member at the CMC Vellore, Registrar Neurosurgery at the Morriston Hospital, Swansea, and consultant at the Morriston Hospital as well. His expertise extends to a wide range of neurosurgical procedures, including minimally invasive spinal surgery, microneurosurgery for brain and spine tumors, vascular anomalies, skull-based surgery, pediatric spinal cord surgery, aneurysm and alien surgery, and many more. Dr. Ranjan is a national faculty member for minimally invasive spinal surgery and actively participates in workshops and training programs. His significant publications in renowned medical journals and active involvement in national workshops and training programs demonstrate his continuous learning and dedication, and he also holds memberships in prestigious national and international neurosurgical associations, further enhancing his professional standing. Dr. Ranjan's extensive experience and academic contributions make him a leading figure in the neurosurgical community. Thank you, Dr. Alok Ranjan, for joining us in this discussion today. We're delighted to have you here with us.
Thank you, Dr. Srinidhi. It was a very long introduction for a very small person, but thank you anyway.
Not at all, Doctor. So let us begin with the basics. So we could begin by you telling our viewers, what are the unique features of the brain compared to other organs in the body?
See, to start with, we know that the brain is contained within a hard skull. So it could not be just a chance. God created the brain and needed to protect it with the best possible structure in the body, a structure called bone. It was so precious that it needed to be contained within a bone. Now, bone is not a dead organ. Bone is a growing organ. So it needed to be contained in that way so that it can be protected, because brain is what we are. Today we are discussing because we have brain. When the child is born or child is conceived in the fetus, and a cell comes from the mother and a father, and from there the development of the body takes place. the first structure which actually develops in the fetus is the brain, the beginning part of the brain. And that actually governs the development of the rest of the body. So it shows you the importance from the nature itself. The brain is very important. It really controls every thought. It controls our love, our hatred, our anger, whatever emotions we have, the right answers, the wrong answers. And we only feel the need and feel the lack of it when we make a mistake which puts us either in a danger, embarrassment, or whatever. So it controls practically every sensation, planning of the movement, execution of movement, what to say, what not to say. And why we are discussing it? Because these plannings, when they go wrong, is where the neurological conditions start.
So what are the main functions of the brain? Like, we will discuss a few of them now, but what are the overall functions that the brain has?
So there are some basic functions and there are some higher functions. The basic function is like a function of movement, which is in a part of brain called frontal lobe, posterior frontal lobe. Then there's a sensation, what we perceive is what is in parietal lobe. It will amaze the audience to know that brain by itself, if you poke your finger, is painless. But this is where we feel all the pain. Everything is well, such a wonder of nature. Our memory is mainly in a temporal lobe. Our vision is mainly in the occipital lobe. Our balance is mainly in the cerebellum, which is the lower part of the brain, which goes to the spinal cord. It will also amaze you, and it is very nicely said, that it is the left side of the brain which makes you a human, or rather a being, and it is the right side of the brain which makes you a human being. So all the higher artistic ability, music, appreciation of music, all the great architects, those functions are mainly in the right side of the brain. So there's a laterality to the function as well in the brain. Not only the basic function, but laterality of the function. And then comes the higher function. That's why you have an Einstein, and that's why you have a person who cannot do any calculation. It's all a function of higher function. So there's a huge lot of brain, which is actually now we are getting to know is called association cortex and prefrontal, which is the front part. And if we compare our structure with, let us say, a monkey or something, first thing you will notice that their frontal part is totally sunken. It is this part which makes us what we get an evolved person. And if you see any of these movies and other things, you will find that there's a much more prominent frontal area and the flattened the back area in all those, the various series of 1,000 years down the line and 2,000 years down the line. That's what makes us what we are.
That's fascinating. So what are the major diseases that now affect the brain, which you think people should be aware of? I mean, I know that this is a huge next topic, but for the sake of our viewers, I
will try to classify into three broad categories. One, which a structural lesion of the brain, which mainly comes into the role of neurosurgery. One, a lesion of the brain, which we know by various investigations that there is a problem, which are non-surgical, which mainly comes into neurological diseases. And one in which we find everything looks normal, but the patient is very abnormal, like obsessive compulsive neurosis, schizophrenia, which comes into the domain of psychiatric illness. All three are part of the brain. In the main neurosurgical problem, it is a road traffic accident which causes head injury, and practically all of us have had a known person or a family member which has suffered like that. So depending on where you have injury, you may recover to a person who will die. And dying is not that bad, but being a vegetative state lying on the bed is horrible. It can be a tumor like anywhere else in the body. It can be a benign tumor, which is potentially curable, and malignant tumor, which in today's world is also potentially controllable, and some of them are curable, but some of them are not. Then it can be any structure in the brain, such as blood vessel can have abnormality. like we call aneurysm, which bleeds in the brain, or arterial venous malformation, which can bleed or cause seizures or something like that. So those are the things. These are all structural lesions. But one more thing to emphasize is the pediatric. You may be born with one of these acquired condition or born with the defect during the fetus itself, which encompasses a lot of problems. Those are, you're born with like myelomeningocele and spina bifida and things like that. Fortunately, those diseases have come down a lot, and you'll wonder how it came down, because there's a one particular vitamin we take, folic acid. It was introduced in the system and it brought down these diseases by huge number. That tells you that sometimes these are the small things which can cause these big things. We just need to find these small things are related to the problems in the big thing. Then you have a neurological condition which a lot of people suffer. Alzheimer's, dementia, we're getting more and more as the age. Patients' population is aging. We have what is called movement disorder, Parkinsonism. We have something called tremor, intention tremor. These are all treatable conditions. We have demyelination. A lot of people must have heard about multiple sclerosis. So these are the demyelination conditions. Then you go to the realm of epilepsy. One is such a big thing. Epilepsy can have a structural lesion, and we may not find any structural lesion, but still there are a lot of things we can do. Then we come to the psychiatric part of the brain illness, such as schizophrenia, obsessive compulsive neurosis. And why I add in the brain that 25 years back, when I was studying 30 years back in medicine, this was pure as if the brain is normal. But as we have learned more and more research, there are also abnormality of the chemicals. We just have learned that chemical abnormalities cause these things. So they are also disease, like any neurological condition. It's just that we are getting to know more and more about it.
So we will discuss a little bit about the workplace, since this is also addressed to the corporate audience. So what would be among these conditions, particularly you spoke about head injuries. So what are some of the emergencies that can happen related to the brain at the workplace? For example, a stroke or, I just wanted our audience to understand what they should do and what are some of the common warning signs or something that they have to watch out for in the workplace.
So I will go for more common conditions which affects a lot of us. I will say first of all is head injury and spinal problem. We know that the neck pain, back pain, neck disc problem, spinal problem are very common in the IT population, corporate places. But in the brain problem is common. Most of them drive two-wheeler. Most of them are young. They have a car. They may wear a seat belt, may not follow the speed rule, and they come to casualty with bad accidents. That is also part of workplace injury. In my view, that is also a workplace injury, because the time you leave your house to the work, your work starts. By the time you land home, work. So that is part of injury. Then comes stress-related diseases, or some of them have genetic preponderance like hypertension, diabetes, uncontrolled, bad working environment, bad surrounding. These are the people who suffer from stroke. Now, what is a stroke? Very simple. If you have a one-side weakness, one-side numbness, your speech is getting slurred, the first thing to think is a stroke. And stroke is called time is important, is a golden hour. If you reach within golden hour or two, in today's world, there's a very good chance in 2 days' time you'll walk out normally, because we can do lots of procedures to take out the clot or things like that. Then comes related diseases. One is stress-related, what we call, I'm worn off, I'm tired, I can't continue. This is a very common refrain in corporate world, that I'm burnt off. Literally, actually, you have burned off all your connections. There's no energy for you. That again is stress-related. There are diseases like tumor or something which occasionally work-related, but I won't go into that. Yes, you may be presenting with a blood vessel rupture. That can be stress-related. So these are the conditions where workplace environment is very, very important.
One thing which people often talk about is a headache, though it might not be related to the brain as such. But we often hear people at work saying that, oh, by the end of the day, I have a headache, I need another cup of coffee. So maybe a little bit about that as well, though it might, of course, not always be related to the brain as such.
I think you have asked most relevant, wonderful question in this. Headache is related to brain. You don't have brain, why will you have headache? So basically, headache is one of the commonest refrain, and it has got multiple ways of coming. You may be a type A personality. You may be a personality who cannot deal with common stress, or you may be a person who is subjected to uncommon stress day in and day out. Your work environment does not allow you to have meals at a regular interval, or it gives you meals of a very poor quality, which apparently is good, something like high cheese and high this and high that, but not relatively healthy. You are not given time to sleep, or due to the work pressure, you don't sleep properly. Then in today's world, the travel to the workplace is probably one of the worst things, because to stay near your workplace is a luxury for most of the people, because socio-economically it may not be possible for most of the people. That comes again to quality of travel. How do you travel? How unsafe is your travel? How safe is your travel? All these things can come to a situation where the stress-related headache becomes more and more and more. So how do we overcome that stress-related headache? By taking caffeine. But then caffeine is not the treatment for headache. Caffeine will kill your appetite. You will not have food. You will develop hypoglycemia, which will precipitate your headache. You are in a high air-conditioned compartment and a big room. You go out for a breath, fresh air. Again, from hot to cold you turn. You have this. You don't do exercise regularly. You're always under this physical and mental stress. Headache will come. So the headache is literally and figuratively is a big problem. And unless we learn to live with a very disciplined life, it will not only affect you personally, but definitely it will affect the quality of the work you produce.
Now we will go on to this issue of the cognitive decline that happens. Is there something that causes this, to happen earlier, or is there something that people can do? Are there risk factors that contribute to deteriorating neurological health? Not just cognitive decline, but any neurological decline that happens. Are there any preventable factors?
Absolutely. So cognitive decline is a normal process. Every person will have a cognitive decline as the age goes by. If this decline is significant enough to affect the quality of the work you do, then it becomes a problem. Of course, if it is too much of a decline, like someone has got dementia and things like that, that's a separate matter altogether, but in normal day-to-day. So what? No physical activity, no exercise, high stress, diabetes, hypertension, improper food, timing bad, no sleep, no socializing, no friends, only work. This is a recipe for disaster. This is a total recipe for disaster. And all these things will lead to a cognitive decline. Because we know that when you are born, you can't even walk. You just crawl. That also takes time. Then there's a rapid development. One thing has been noticed, that if children who have been in the fetus, it is said that a Jewish mother listens to good quality music and reads good quality book. As a result, these guys are born with better brain. The example for that is a vast majority of Nobel Prize goes to them. They are creative characters. So the fetal health itself is important, because in the fetus, good stimulus, good food, good nutrition starts from there. Then we say that if you have good education in early childhood, is the biggest negative risk, means biggest contributor to have positive long cognitive function. So the people who are given good education in the beginning tend to have less neurodegenerative disorder. Then the second thing which is said very commonly is that people who do the work in which they are very good and they like doing the work and enjoy the work is the second biggest factor which makes you less prone to neurodegenerative disorder. And of course, physical activity. Physical activity, a regular exercise at a regular time, that doesn't mean you pump 200 pounds of weight. A regular exercise, a walking or a gentle running at a fixed time of the day without too much of distraction, not only creates a feeling of well-being, gives a rest to mind and the body, but it also allows brain to regenerate. The dead cells will regenerate. So that is very important. Nutrition, fantastic role to play. The type of nutrition and social behavior. Good friends, not good colleagues, good friends, where you can be what you are. These are all very positive changes, positive environmental factors which diminish the rate of neurodegenerative disorder, which will happen to anyone, but it diminishes that rate. Sleep, probably one of the least talked about, but the most important factor. Good sleep, 6 to 7 hours.
And perhaps also learning new things, developing.
Yes. So a lot of work has been done about learning new things. Yes. There are lots of applications also has come. It will surprise you that the app to keep your cognitive ability intact is a $5 billion business yearly. But however, it must be stressed that since it doesn't harm you, but does it help you? Other than these factors, these apps don't help you. They make you better in exactly what they teach you to do. But in other side, they don't make you any better. Your processing speed or your thinking ability does not improve. But what you are playing, it will get better. But it doesn't harm you. Probably it relaxes your brain. But this is not the substitute for what I said earlier. The lifestyle.
And also, doctor, at what age should people start thinking about, taking some preventive screening or getting worried about their brain health? Because now we are seeing that people should have their annual health checks. And some of it, most of it is related to other parts of the body. There is a lot of cardiological investigations, cancer screening, blood tests, all that. But then, is there something that people should also screen for their brain health as well?
So, see, brain, one is obviously assessment of a person's intellectual or physical capacity. That can be done only on examination. As an investigating tool, doing a routine CT scan is a bad idea because it gives you radiation. But of course, at certain age, you can do an MRI scan. But question is for what purpose? Because the investigation in brain has to have a purpose. But more than that, what is good for heart? What is your lipid profile? Do you have diabetes or not? Do you have hypertension or not? What is your dietary schedule? These things are also true for the brain. So they can be very much part of the brain. If a person has noticed, or his colleagues or his boss or his juniors has noticed as some kind of abnormal behavior pattern, something which is not the same it used to be, if that can come to the right person, and an assessment in that category of person will be very, very useful. But I think after every individual after age of 40 should have some kind of assessment, and that will be at least a screening for your brain activity. The good thing about brain activity is that when we ask for how is your heart and how is your this part of the body, every answer has a brain activity. So we can actually get a fair amount of information by questioning itself.
What about the red alerts that, as one goes on in life, are there any red flags that must prompt you to take immediate medical help regarding the neurological aspects?
Red flags are to be noticed by the patient, and the red flags have to be noticed by the colleagues, family, and friends. Patient may not be aware of those red flags, and that is a red flag. If a patient is not aware of the red flag, that is a red flag. So the red flags are You are forgetting time and again something, not once in a while. There's a pattern to your forgetfulness. You have keep on missing things time and again. All these things must raise flag. This is for a cognitive capacity. But of course, one can notice any weakness, any numbness, things like convulsions, which may not look like a severe jerky movement. It may be just brief period where the patient seems to be unaware. These things have to be noticed by the patient as well as the relatives. So all these things are red flags. So any kind of asymmetry of activity in terms of physical, motor or sensory, or speech abnormalities, slurring and things like that, or forgetfulness on a very consistent basis, or irritability and behavior changes in a very basis, they are all red flags. But unlike cardiac or other things, here the friends, family and colleagues have an important role to play. Because quite often, they will see the red flag before you have seen.
There is also this term that people use, just like burnout. There is also this term called brain fog. What is this, and is there something that people have to be worried about if they think they have it?
So brain fog, broadly speaking, is that you cease to function in a very appropriate form for some time. Now, is it physiological or is it pathological? Physiological is because of a constant stress, lack of sleep. There are a small island of time where you do not think coherently or you don't behave coherently. But more often than not, if these fogs are happening very, very frequently, without an obvious sign of stress and other things, immediately it should raise the alarm. Am I having a disease, structural or non-structural, which is impairing my cognitive function? So yes, these are important things. But it comes to the next point. The preventable things like lifestyle, stress, which can chronic stress, and a kind of, in today's world, you are given a task to complete. This is your job, and then more and more work is given to you. And if you are a good worker, then there will be obviously more and more work given to you. It can lead you from a very stable personality to an unstable personality. And these fogs can happen. So chronic fatigue, chronic stress, missing the other diseases. You may be a diabetic, of all you know, and you have not been recognized as a diabetic. You are getting hypoglycemia that time. You will have a fog. So things like that.
I also wanted to ask you finally this question about, when people have these neurological emergencies, for example, a stroke, many a time there is a little confusion, especially if it's in the workplace. So, the kind of health center that you choose to go to, when we talk about golden hour diseases, can you give a few pointers to people on what kind of a center? Because many times they think when you go to a doctor, it means maybe going to your clinic next door, which might not have all the facilities, but they still think they're taking medical help. So this, I feel, is something that has come up quite a few times in our own clinical reviews and things like that, where people say they've gone, but then it's far too late by the time they go to a center which is actually equipped to treat a stroke. So, or even a road traffic accident or a head injury. So what are the few things that people must look for when they are going to a place for an emergency neurological treatment?
So there are 2 points which you have brought out quite clearly. There are two types of neurological condition where we need time, quick reaction time. One, I will go for stroke. Like heart stroke, in a brain stroke, you should go to a center which is capable of treating you, not diagnosing you. Yeah. Because you cannot afford to waste time for diagnosis. It will surprise you that in Apollo, when you ring up 1066, your treatment for stroke starts from the time your phone call comes. And by the time the paramedical reaches you, which will be within 15, 20, 30 minutes, he will have a full capacity to support your respiration and blood pressure then and there, and bring you to a center where the blood part of the investigation is already done in ambulance. And the part of the investigation is done within 10 to 15 minutes, and you are in the scanner within 10 minutes, and your treatment has to start within. So in 1 hour time from the call where we have been called, we should be able to diagnose the condition and have a plan of action. Sometimes we require a bigger procedure. That also you should have a center. So you should always go to a center which is capable of treating you, not diagnosing you.
Absolutely. I think that's a very important point there. Anything else that you would like to add, Doctor, before we close?
Again, for a road traffic accident injuries, very important to know, and you generally, majority of my road traffic accidents are these software guys who travel on a motorcycle. Sometimes due to mistake, their mistake, or sometimes due to someone else's mistake, they are the victim. So there are two types of injury they have: brain injury and spine injury. Now, in a place from where you are lifted up, there should be no hurry to lift him up if he's conscious, because by lifting him up in an inappropriate fashion, you can make a incomplete spinal injury complete spinal injury. But if the patient is unconscious, obviously, try to turn the whole body to a side, because sometimes people die of the vomiting. The vomit goes into the lung. So just whole body, not the half the body, not the head. Whole body should be turned to one side, so the vomit, if comes out of the mouth. Then the whole body has to be treated like a plank of wood, which cannot be twisted, has to be shifted. For that, you require some kind of a specialization. But if the person is fully conscious and says, I've got neck pain, don't move him. Just put a brick on either side of the head so that he doesn't move his neck, because you may be saving his life. These simple things, again, there's no point taking them to a diagnostic services. You have to take to a place where the worst of the injuries can be taken care. Remember, 60% of the head injury patients have injuries of rest of the body. So there can be multiple injury trauma, we call polytrauma. So, number one, in today's world, I assume every corporate person knows the emergency number. Apollo is there everywhere. If not Apollo, there will be some other hospital. We have a very simple number to remember, 1066. I use it. I used it for my father. I'm sure someone else will be using it. Use someone who can treat you, not diagnose you. Diagnosis has to be done on the phone. Treat you. And that way we will save people. And one special advice to the corporate bodies: a healthy body and a mind will give you much better result than a tired body and a healthy mind. Every employee needs a good working environment, a good sleep, a good nutritional choice. These are things which can be done by anyone. And if you find these warning signs in an employee, or the friends find him, then reach a specialist who can assess the person. Now, we are in the world of multimedia, We are in the world of screens. I face the problem with my daughter. I'm sure you will be facing the problem with your child. I was just reading a very interesting article that we are the baby boomers, my generation, and we are either at the head of the table or we are retiring. Then came generation next, and then came the net generation. And apparently after 1980s is the net generation. In a net generation, in today's world, a child is fantastic in multimedia. He can do a Facebook, Instagram, Snapchat, and mind what all at the same time. Does it help you? Probably it helps you in going to the site very fast, but it decreases your reaction time. It decreases your problem-solving abilities. These are all well documented. So screen time has to be avoided. And a person like IT industry whose anywhere work is a screen time of 8 hours, further 8 hours of screen time is of course very unhealthy for everything. So everyone must realize that they need a balance of physical activity, work activity, and a good sleep and a nutrition. And of course, great friends and colleagues.
I think I cannot help but also still continue this with one last question. about this environment of work pressure often leads to substance abuse, which again is related to the brain. So maybe a quick word about that.
Thank you. Thank you for remembering that. There were substance abuse from the time of Ramayana and Mahabharata. But here we are dealing with a situation where this substance is so easily available from an app away or a phone call away or a friend away. That means alcohol, that means tobacco, that means drugs of various kinds, the names of which I don't even know. Again, these are because of few factors. One, peer pressure, if you're not in the right environment with the right people. Number two, a lot of money in your hand and you need to experiment without having a knowledge of the side effect of it. And third, you think you have a control of your body, but you lose control over time, and then the substance controls you. You no longer call. The moment you fall into that trap, then of course your work will suffer, everything will suffer. So I think, again, I will come down to it. You need a good family environment. You need a good friend system. You need good colleagues. You need a good work environment where there are people who will go for that abuse, but people who are pushed into that abuse can be avoided.
So I think we've had a very, very extensive discussion about brain health, and thank you so much for covering nearly all aspects of it in a very concise and simple way. I know that it's a very complex and extensive topic. Viewers, I do hope that you have enjoyed this session, found it informative and useful. Your brain determines every aspect of your life. It's working tirelessly for you, 24 hours a day, 7 days a week. And today, when we all live longer, we must aspire to live a healthier, fulfilling, and also mentally healthy and alert life. And as Doctor said, a lot of it also rests in our hands and our lifestyles. So I do hope that you've got some useful pointers so that you can ensure that your brain span matches your lifespan. Thank you so much and see you soon.